have Dr. Maya Gharfeh with us. Hi.
That's the number one trigger that we see for eczema. It's fragrances and dyes. It's a lot to unpack there.
It is, and I have so many questions, but I'm going to try to not ask all of them and just ask the ones that are burning for me.
There was nothing there that we did wrong, Mom, that you did wrong, that led to your child developing eczema.
Welcome back to EpiPod. Danielle's had anaphylactic food allergies her entire life.
And Sarah is a food allergy mom to 2 kiddos.
Managing this invisible health condition can feel so isolating.
Do you also feel like you have a degree in overthinking?
If you're nodding your head like me, then you're in good company.
Let's get you off that allergy island right now with people who get it.
Ready to dive in? Hey, Danielle.
Hi, Sarah.
I am excited to have Dr. Maya Gharfeh on the podcast today to talk about all things eczema. I mean, that is such a hot topic. Both my boys had eczema, and there's all this new research that is saying certain things that I didn't know when my kids were little. And I was just really excited in this conversation to be able to ask her all of these questions that I've had for a long time and really just kind of clear the air. And I think we all as moms just want the best for our kids. We want to feel like we did everything we possibly could to make sure that they were okay. And so this is like the new now information. Like if you are curious about how to like best prevent or do your best to prevent allergies or eczema in your kid, like this is the conversation you need to listen to.
It's also one of the topics that we get DM'd about the most and that are percolating, whether it's in our private messages or in the comments with the EpiPod community. People are always asking about eczema or, you know, writing in being like, hey, there, I heard this, like, is this true? Or, hey, like, what do you use for, like, Sarah, for your boys? Like, what do you use for eczema? And being able to talk to not only a board certified allergist, an actual MD, but an food allergy mom as well is so exciting to be able to talk about, you know, all the different things that we're told that we see online down to products. And also just like her messaging, like you said in the interview, it feels like a warm blanket. It's like a hug that I feel like a lot of moms and allergy moms who also battle eczema are really going to need.
Yes, absolutely. Okay. Well, Dr. Maya, she's also known as Allergist Mama. She is a board certified allergist and a mom on a mission to make food allergy care more accessible, empowering, and human.
With a passion for prevention, patient education, and family-centered care, she blends clinical expertise with lived experience to support parents navigating allergies in real life. Through her online community and the Allergist Mama membership network, she shares practical tips, evidence-based insights, and honest reflections from both sides of the exam table.
All right, let's get into the interview.
We have Dr. Maya Gharfeh with us. Hi.
Hello, so great to be here.
Digging in a little bit into eczema and allergies and how those two things relate. I always hear mixed messaging about this, like, you can have one without the other. One doesn't necessarily mean that it's a trigger for the other. There's all these different things I hear. My kid definitely had eczema before learning about his food allergies. Then I had a second, same thing. They still struggle with eczema. And I swear sometimes that certain things they eat or do triggers their eczema. But then I also hear allergists say that food cannot be a trigger for eczema. So can you set us straight just on that, straight out the gate?
Yeah, so this is something we see so often, right? We talk about, and you've probably heard about the atopic march. So where a child who's going to march along to atopy might start with eczema and then develop into food allergy or environmental allergy and then asthma. So we see that march quite often. And so, you know, when I talk about eczema, I have a little spiel, if that's okay, but that's kind of, this is the spiel I give my patients when we come in for eczema, because I think being on the same page as far as what it is and then how we're going to approach it is such an important part for the care. So the first thing is understanding there was nothing in utero or in early first 2 months of life, you know, because eczema usually pops up around age 2 to 3 months. there was nothing there that we did wrong, mom, that you did wrong, that led to your child developing eczema. It's in their genetic makeup. That is just how they were made. And so knowing that it is just in their makeup, helps us understand that there are certain attributes to their skin that we're going to, as the primary caregiver, have to work a little bit harder to help them make up for what their skin can't do on its own. So that leads to kind of these three pillars that I talk about. The first pillar is the eczema triggers. So what we've seen with the evidence, and there's an atopic dermatitis or eczema a practice parameter update that came out again at the end of December 2023, so around the same time that our anaphylaxis updated parameter came out. That again kind of emphasized the triggers that we see. It actually talked about all eczema things, but it emphasized these triggers again, that the number one trigger that we see for eczema is fragrance and dyes. So this is a lot, and this is really huge, because what do most of us get in our at our baby showers?
Yeah.
Big tubs of Johnson & Johnson products, of these Aveeno products, these scented, sweet-smelling, baby-smelling things that then once the baby comes home, we lather them in it. We say, doesn't my baby smell so nice? And we bathe them in these things. And that's the number one trigger that we see for eczema. It's fragrances and dyes. It's anything and everything that touches their skin that might have any kind of fragrance or dye. And I extend this a little further to also include any kind of essential oil and any kind of added food particle in products touching the patient's skin. So if you look at it, the more trendy a product, the more likely it is to have some sort of added food particle. I've seen anywhere from cucumber extract to avocado extract to almond to dandelion. I mean, all of that is potentially irritating. So there's a few lines that I do like. CeraVe, Vanicream are kind of my go-to at this point. But even those, we are constantly going to look at them and make sure that they didn't change their formulation and add any kind of fragrance or dye. I just had in clinic, I think yesterday, someone asked me about beef tallow. That's kind of a popular thing too. But again, that is a food particle. And so I really try to recommend against any added fragrance, added dye, any essential oil, or even food particle. So that means soaps, shampoos, body soaps, moisturizers, detergent, all of it. And this is included for the patient, for the baby, but also for mom and dad, for the other people in the family, because a 2-month-old is in your arms all the time. So if you're washing your sheets or your clothing in, sweet smelling, downy, whatever, it's going to transfer to the patient. Same thing with if you're wearing a lot of perfume or doing a lot of cologne, that's going to be a potential irritant. So look at that as serious as you would look at as a food allergen. This is an important, really important part of keeping their skin integrity very healthy. The second trigger that we see would be environmental triggers. So these might be dust mites, these might be animal exposure. But what we know about aeroallergens is it's very rare to develop an allergy to these things, typically before the age of 1, very, very rare. And outdoor allergens, very rare before age 2. So most of the time, if there's an allergic trigger to the eczema, that's something that's going to pop up more for my older child, my teenage patients, or my adults that might have persistent eczema, and maybe that's related to an animal exposure or to dust mites, and we see that sometimes. The least likely trigger is food. And it's so low likelihood of a trigger that we recommend against testing patients for food allergens. And there's many reasons why we don't do it, but the biggest reason is it's just not a big trigger. And even if the food is a trigger for the eczema, it is not through the IgE-mediated pathway for developing a skin reaction. So why would you test through an IgE-mediated pathway? Why would you get a skin test or a blood test for that pathway, when even if foods are involved, it's more through the inflammatory T cell pathway. So it's like testing apples with orange. It's just completely different. And so most of the time for our eczema patients, I don't want to get too much into the immunology, but because they have such a high total IgE, antibody IgE, their blood testing, their serum testing for all these specific IgE values are going to be high because it's skewed high from the total IgE. So it's a very confusing test to look at for those that have eczema, and honestly, an unnecessary test.
So let me just make sure I understand what you just said. So you're saying that somebody who has eczema that is, say, triggered, or, you know, a flare or something, if you were to do a blood test for IgE, it's going to be high due to that, not necessarily because they have like a super severe egg allergy or something like that. So the number is not necessarily just because you're allergic to that food. It could be because your IgE levels in general are high.
Exactly. So think back to, I always like to give the correlation of back to college when they'd grade tests on a curve. If everyone flunked out that test and the professor decides, I'm going to grade it on a curve, so now a 50 is actually an 80, that's the same idea that we see with the IgE values. So a normal IgE is going to be anywhere from 50 to 200. But in the case of atopic dermatitis or eczema, their IgEs can be in the thousands. And that's just because we know that those that have eczema they just carry a high IgE. As their eczema gets better, that IgE might go down, but they might walk around with an IgE in the high hundreds all their life because they're just an atopic person. But that value matters so much, that total IgE value matters so much when then we look at the specific IgE values for the different foods. And so that's why I hate getting blood tests for patients with eczema. It's confusing for everyone, and then we end up unnecessarily avoiding foods that are critical to be exposed to during that time frame when the infant is still being exposed to all the allergens and hopefully developing a tolerance rather than growing into an allergy. And so if we test foods on blood testing and we get lots of what looks like it's positive, and we avoid all the top allergens for months, maybe years, maybe that child could have never developed an allergy because they kept that exposure going. Does that make sense?
It totally
It's a lot to unpack there.
It is, and I have so many questions, but I'm going to try to not ask all of them and just ask the ones that are burning for me. So you talked about how, first of all, when you said that moms didn't do anything and that like your kid is just born, with this kind of predisposition to have eczema or not, like that is so like a warm blanket that you just placed around my shoulders, because as a mom of 2 kids with allergies and eczema, you constantly blame yourself. Like you feel like you can't win. You feel like you did something wrong. Even other people in so many words, even if they're not directly saying it, kind of place blame on the mom. Yeah. What did you do? What didn't you do? So that alone, just thank you for saying that. But one question I have is, you said that, these dyes and perfumes, whether it be on you or someone holding the baby or a lotion that you're putting on the baby, if, say, I had a child that didn't have the predisposition to eczema and allergies in this atopic march, if they were smothered in a cream that had a almond oil or a oatmeal, whatever, or, my mother-in-law holds them with all the scented things, mm-hmm. Are they probably going to be fine because they don't have that predisposition and it doesn't really matter? Or if somebody without the predisposition has those triggers on them, they can develop it?
Yeah, so it's hard to know when a baby is fresh, a newborn baby, whether they're going to march down, which road they're going to march. Are they going to be an allergic child or not? So honestly, I just say just avoid the fragrance things until At least 6 to 8 months old. At that point, the skin is a little bit more, it's a little thicker. You have a little bit more resilience to it. You can monitor and see when you use a scented product, how does their skin respond to it. I think that's just the safest approach to take. And I honestly, for baby showers, I do give most moms CeraVe instead of the Johnson & Johnson because I want them to have that. I want them to have something that I think is a better option regardless of the case.
I didn't know that information, right? Like I only had the information that I had at the time when I had my kids. And I certainly wasn't thinking about allergies. I wasn't even thinking about eczema straight out the gate, because they didn't have eczema at, 2 weeks, 3 weeks, whatever years old. So I'm sure I used certain products or I sprayed a perfume or people holding them had stuff all over them. I know for a fact that I think about how my youngest has a sunflower seed allergy. Mm-hmm. Graham had nut allergies. Mm-hmm. So we only ate sun butter when my second was born. Mm-hmm. And the only allergen he has is a sunflower seed allergy, which could it be coincidence? Maybe. But I also feel like we probably were eating it around him, kissing his body that had eczema with our sun butter mouths. This was definitely something I know that happened. And so I think I do place some blame on myself for that, although I didn't know at the time what I was doing. So all I guess I can do is spread this message now or help spread the message. And so are you saying that, those things are something that we need to be really careful of too. Like it's treating them, like you said, just like a food allergen once you're diagnosed.
Yes, and that kind of leads to the second pillar. So the second pillar is making sure that we're moisturizing. So that skin, again, just the way that it's made, doesn't retain moisture very well. And so when you moisturize with a product that's free and clear, you're able to kind of beef up the skin cells a little so that they can create nice tight junctions and not allow allergens like the sunflower kisses or the other outside irritants to be absorbed and then start to cause that first exposure of sensitization, if that makes sense. So the regular baths, the moisturizing liberally, helps to give more water to those cells, but also creates a nice barrier to the skin. So it acts as a second wall of protection over the baby's skin so that as the baby's kissed on, loved on, starts to crawl, starts to get into all of those aeroallergen exposures and maybe even food exposures with what might, fall to the ground and things like that, they have that wall of protection. And so moisturizing is incredibly important for treatment. And then the third is just controlling the itch, which often cycles to the rash. So we call eczema the itch that rashes. And so addressing that itch to prevent more rash, which is open tiny micro abrasions that allow, again, for sensitization through the skin of the allergens is really important. I see a lot of hesitancy in treating eczema with some of my patients, and I think some of that is due to some fear-based information on topical steroids and, all of that. But, if we don't treat if we don't treat it, you're really setting up that skin to be a very weak protector for the child from the aeroallergens, from food allergens, from all types of allergens. So it's incredibly important that we use the treatment in the right way, when it's needed, we use it in the right way, and that we're not afraid to, again, talk to your provider about what you're comfortable with, not comfortable with, but to address it, because that's going to be important to see where that march hopefully can kind of pause and not continue to grow.
It's so damned if you do, damned if you don't, because, as a 90s kid, my mom was all about the fragrances. Like, you look at the products that are even in my own, I'm not a mom, and there would be an immaculate conception if I became a mom, but right now, but I open all my beauty products, either they're the super, toxic, fragrance filled, chemical out the wazoo. There is no free and no clear anything like that about it for most of them. Or you have the opposite side of the spectrum where it's like, as women, we're told like, you know, all this stuff is trash, get all the toxic stuff out. Like, here are all of these like natural, you know, throw out your lotions, do the beef tallow moisturizer. Okay, all of your makeup is toxic for you. Here are these more natural, clean lines. Well, what are in the ingredients? Almond oil, milk, avocado. Like, it is all food-based. And so then I think, like, as somebody who, with a food allergy, you're always like, contamination, like what is where and how is that going to spread onto me? But I'm just thinking, like, as a mom, okay, like, you're damned if you do, you're damned if you don't. Like, what products are safe then? Like, either you're going like all of these fragrance toxic things, or you're in the beef tallow and almond oil makeup. And it's just like, well, what? We need like a database of like what's in the Venn diagram of like
right. I know. Yeah, and I mean, I think, again, how much of that is really based on evidence and how much of that is fear? You know, how much of that are the products that we claim are toxic, are they really toxic? Or are some of them actually just fine? You know, there's a lot of, I mean, not to get into the nuances, but petroleum jelly. Oh man, we're putting oil on it. Are you really doing that? I mean, you know, there's a lot of fear information out there. And I mean, same with, you know, these food particles and these natural things. We want to teach the evidence. And what the evidence tells us is that these can be potentially irritating. But if you get to a place where your skin is nice and clear and you're able to try one of these you really want to use the beef tallow. You really are dying to try that trend. Okay, try it in a small little patch setting. See how the child's skin responds to it. If they do great and you are able to keep that going for months and fine. I mean, fine, that's fine. Maybe he or she is not allergic or sensitized to that product. Great. But let's not make that the blanket statement for, you know, everything. Every patient encounter is unique. Every patient's skin is unique. What you're allergic to might not be what another person's allergic to. But what we know is, you know, most of these food derivative products can be irritating to the skin. I mean, a great example is lanolin. Lanolin is in Aquaphor. I mean, we used Aquaphor for all babies, all infants with eczema. Now, I think it was 2, maybe 3 years ago, lanolin was the #1 contact dermatitis trigger of all contact dermatitis triggers. So, I mean, these things we can develop allergy to. So we have to be aware of, you know, every situation is unique. If it seems that the standard isn't fitting, we're not getting better with XYZ treatment, talk to your allergist, see if there's certain testing that can be done, which there is something called patch testing that we can do to see if there are specific topical ingredients that need to be avoided in skincare lines, which can be very helpful to see.
I've heard the phrase before, through the skin allergies begin. Is that kind of what you're talking about throughout this whole time so far? That, I mean, you don't have to get super technical because most people listening are not scientists and doctors, but can you explain just a little bit of what that means and the science behind these like T cells that remember the allergen when they enter the skin and then somehow in our bodies decide, okay, we're allergic now to that thing?
Well, all allergy starts with a process called sensitization. So it all starts with the first exposure to, let's say, peanut through food allergy, or fragrances for contact dermatitis or for atopic dermatitis or eczema. So it all starts with some sort of initial exposure that we call sensitization. And the best way I can explain that is it's kind of like the immune system just has a, hey, nice to meet you, hand outstretched, we're gonna meet and I'm gonna see what I think about you. And then from the process of sensitization, it can either proceed towards tolerance or allergy. So if it starts to develop allergy, it will, in the case of food allergy or environmental allergy, start to create IgE antibodies targeted against that specific food allergen or aeroallergen. In the case of contact dermatitis or atopic dermatitis, the T cells will create an inflammatory response to that specific contact derm trigger or atopic derm trigger. And so then with every subsequent exposure, especially in the food allergy or aeroallergy standpoint, every subsequent exposure, the IgE antibodies specific to those allergens are sitting on the allergy cells, primed and ready to go. And so with any subsequent exposure, it causes immediate degranulation or release of histamine from the allergy cells, and you get an immediate hypersensitivity reaction. So you get that immediate, the food allergy response. In the skin, it's not quite that immediate because it's not through the IgE pathway, it's through the T cell pathway. But the allergen is exposed to the T cells. The T cells also have a receptor. They also receive it. It stimulates the T cells to release what's inside of them. But what's important here is T cells don't have histamine inside of them. They have inflammatory signaling inside of them. So T cells, I don't want them to sound terrible because we actually really need our T cells. They help us fight off infection. These inflammatory signals give us fevers. They give us the muscle achiness when we're sick, when we don't feel good. So they're very, very important parts of our immune machine. But when they kind of work against us in the intolerance or even maybe in the contact derm world, it's stimulating an inflammatory response where you get these signals basically to release maybe skin changes, or for food intolerances, maybe some gut inflammation kinds of symptoms. But they can be delayed in onset, so it's not quite as immediate of a response.
Yeah, no, that's so helpful. And I think that alone will help people understand why it's so important to avoid these triggers when your children are very young, in these kind of beginning days and weeks of their life. I think so many of us as parents, we have this growing baby in our belly and we think we want to do everything right. We want to protect them. We want to make sure they are like happy and healthy. And so had I had that knowledge, had that knowledge been shared widely enough to reach me or even have been discovered at that time, I certainly would have followed that. So I think this conversation is just so important. And I hope it reaches a lot of people so that they can, maybe not fix everything, maybe not prevent everything, but do their very best with the knowledge that is now.
Yeah, absolutely.
Yeah. Well, thank you so, so much for being here and for talking about an important subject and just being that reasonable and, evidence-based voice for the food allergy community. We really appreciate it.
Well, thank you guys again for this opportunity.
That was just such an informative conversation, and I am really excited that everyone got a chance to hear the newest, the now, here are specific things you can do to help. I hope that was helpful to everyone.
Yeah, and if you are a mom who is in the throes of dealing with eczema with your allergy kiddo, or just eczema kiddo, or of a mom who is really arm wrestling with this, send this podcast to them.
Yeah, or a new mama, like a pregnant mama with a kid on the way, right? I mean, this could be so helpful. But thank you again to Dr. Maya Gharfeh, and we hope everybody really enjoyed it.